You're listening to Compliance Conversations, your inside scoop on all things healthcare compliance, auditing, and coding. Now, let's get on with the show.
Welcome, everybody, to another episode of Compliance Conversations. I am CJ Wolf with Healthicity, and today's guest is Susan Walberg. Welcome back, Susan.
Thank you. Good to be
Susan
here.
Thank you so much for being here. Susan's been a guest before and has so much good information to share with all of us that we invited her back. And we have some new information for you from Susan, and love to have her. We're going to jump into those topics in a moment. But Susan, you want to refresh our listeners a little bit about yourself and maybe introduce yourself briefly?
Sure. My background is I'm a healthcare attorney. I've been doing things in the compliance space one way or another for about 35 years. Did fraud investigations, worked as a CMS sub, worked as an attorney, compliance officer. Now I do independent consulting, so I have my own consulting business. And the other flip side of what I do for, I guess not even for a living, but well, sort of, is that I do a lot of writing. So I've got books out there. One of my latest is a healthcare technology law and compliance book, and I get into some of the topics from today, as well as things like AI and some other topics. And I write novels as well. So those things keep me busy. So do consulting and do writing, and that kind of takes up my time, but I love it.
Yes, that's so great. And we're grateful for your expertise in those areas. And one of the things that you told me is you're trying to make compliance cool. So you write these thrillers, right? Or novels, fiction. Mm-hmm. Tell us a little bit about that, because I don't think we've ever had a guest who does that. My kids think my job is the most boring thing in the world when I try to explain to them what I do, compliance officer. So tell me about the book and how I can make them read it, and so they know I'm actually cool.
Oh, okay. Well, I mean, really, it's a medical legal thriller, right? But the reason I like compliance is because to me, it's the nexus between law and medicine, right? So to me, a medical legal thriller, almost by definition, is a compliance thriller. But when it's written by a compliance person, it's written from that inside perspective. Like if you're in a hospital and these things happen and you have to go investigate, or there's, of course, when you write a novel, there's bad guys and there's, it's not just doing audits or whatever. But there is those sorts of elements, and I'm writing a series. I call it the Deception series. The first one was Hippocratic Deception, which was dirty doctors in a hospital setting, drug diversion, some stuff like that. And then the second one, which I just released, I'm excited about because I think it's a pretty cool book, is Angels of Deception. It's in a nursing home, and it's a mercy killer storyline with some subplots of politics and drug abuse and a whole bunch of other stuff. One of the points of view is an old lady who's a resident, and then there's a young attorney that's helping her. So it's fun. It's a fun thing to write about, but I do feel like it's a compliance thriller, right? That's just the perspective it's written from. So anyway, that's a plug, but it's also just, I feel like I like to write the books that I would want to read. Right? As a compliance person, like there's not much out there for us. There's medical, there's legal. This is for us. So
that's great. And it sounds like if it's a series, you'll have some others coming as well. And I think you'll be able to we'll share in the show notes links to these books and how people can get them and read them. So thank you for sharing that. I'm going to want to read that because I just think that's kind of cool coming from that perspective. So
yeah, it's fun. I gotta put compliance out there as being a cool thing. So
yeah. So because I was once trying to come up with some eye-catching thing for when we were doing compliance training, and there was a movie. It wasn't healthcare compliance, but it was with what's the actor's name? Last name is Pine. He was in the Star Trek movies, and Chris Pine. So this was a few years back. He was a compliance officer, and they were he was involved in investigating espionage in Russia or somewhere in Europe, and his cover was as a compliance officer for a financial firm. And so that was the first movie I've ever seen where somebody even mentioned a compliance officer. So
oh yeah, I've got mentions in every one of my books. So
cool. Well, good. We'll look for those, and we'll have our viewers look for those as well. So today we want to talk a little bit about telehealth, right? and you have a lot of experience there. And, since the pandemic, telehealth, I think it was already being practiced before the pandemic, but it's solidified, right? Like it's here to stay. People like it. Congress might have to pass new laws so that it's covered by Medicare and all these sorts of things.
Exactly.
But I think the wave is moving in that direction, and we're not going to move backwards. I think it's only going to become more and more prolific as time goes on. And so, with your background and experience, maybe you can share with us what are some key considerations when setting up a new telehealth practice. Like, what do you advise clients and others?
Sure. And just before I start, as a side note, all the stuff that Congress is doing, and not to at all get political, but there's so much emphasis on the technology with the new administration. You see
Right.
all the tech bros lined up.
Yeah.
I think that it's pretty likely that we're going to see more and more focus on the technology. So I think concerns about the continuing resolution, I mean, I get that, but I think that it's going to be front and center. I totally agree. People want telehealth. And now that you've got all the tech guys that are probably influencing policy decision making even more.
Right.
So
yeah, and just like culturally, people do things on their phones, right? Like I pay my bills through my bank on my phone. I set up other appointments to get my tires changed. So why not in healthcare? And so I think just the public's going to demand it, and it might not happen overnight, but over time, it's just going to be the way that we interact with healthcare, I think, more and more.
I agree. And I want to get to your question, but one of the things that I learned when I was writing the health tech book was how much those apps have been taking our data and selling it. And the FTC is cracking down on that with the data breach notification law, because its apps are outside of HIPAA's purview. So people just need to know that too. Everyone's got their fitness tracker and their diabetes monitor and this, that, and the other thing. And that data's been, unless you consent to letting them do it, they're not supposed to be sharing that with Google and Facebook and whoever else.
That's a great point too, because and a lot of us healthcare compliance professionals haven't really interacted a lot with the FTC. I was a compliance officer for an international medical device company, so I did interact a little bit more when you're in that kind of part of healthcare. But like if you're in a hospital, a lot of our listeners might not be as familiar with FTC. So I'm glad you bring that up. There's kind of new eyes, of compliance in different areas in the government.
Yeah, there is. And the FTC and I learned this when I did the book, because I didn't know it either. But the FDA also, if we have software as a medical device.
That's right.
FDA. So, I mean, that's why I did the book, actually, because, and I'm not trying to plug myself here, I'm just trying to paint the picture of the complexity of all these laws. It's not just HIPAA, and I think we're all trained to think it's HIPAA. And
that's right.
And that's, anyway, you asked me about the setting up of a practice. And I'm thinking here of a practice that crosses state lines, like setting up not just a sole office where you're going to provide it for your patients, but setting up an actual practice. One of the things that people need to really understand is the licensure issues. So licensure, where you're operating out of, but also where are your patients? Where are you providing services? There's a lot of nuances there. And HHS has weighed in on it. Must be licensed where they are located and be licensed or allowed to practice in the patient's state. So, I mean, that's a pretty big deal if you're trying to set up. And I did talk to one physician who's done that when I was working on this book, and he was telling me how difficult it is, the licensure requirements. So then each one has a cost. Each one has education requirements. Each one is different. So, I mean, I'm visioning a spreadsheet here, right? With like every state and every single nuance for every license. The owner has to have a license, the providers do. So that's just one of the cumbersome things. Although they are creating these multi-state compacts, where there's like reciprocity. So
and
that's going to keep growing.
Yeah. And on that point, I've seen that nursing seems to be ahead of the game, because like RNs and stuff, because there's a lot of travel nurses, right? And so that reciprocity and cooperatives on licensing is definitely something that's happening and is going to continue to happen. And again, I think nursing is a little bit ahead of the game. So if we want to see where maybe medicine, MDs or physicians or nurse practitioners, PAs, where their licensing cooperatives may go, they may look at how successful the nursing was and maybe kind of follow similar patterns.
Exactly. Another thing is accreditation. Joint Commission now accredits telehealth practices. So that was that's a good one. Maybe everybody knows that. I don't know. Insurance.
Yeah, I didn't know that.
Insurance for telehealth, cybersecurity, professional liability, just those practices. I think that the concern is a telehealth practice might be viewed as simpler or easier, and it's not. It's everything you would have to do and then some for a regular medical practice. The hiring. So thinking about background checks and exclusion checks, right? So if you have a practice that you're based in, I'll say Florida, that's where I am, but you want to have 10 other states where you're seeing patients, then, where are your practitioners located? They may not even be in those 10 states. So
yes,
if you're going to contract or hire, where are all those people located? You need background checks and exclusion checks, and also where have they been located? Because we all know the bad guys move around too. So there's just a lot of care that needs to be taken when you're doing things remotely and people are scattered all over. And that's true for any practice now. I mean, telehealth is everywhere, right? People have all sorts of jobs where people work remotely. So that's just a general word of caution or a reminder. The technology being used when you're setting the practice up, because the laws are changing, HHS requirements and guidance is changing. So I would say before you invest, be very careful that you're investing in something that, HHS or Congress or whoever isn't going to turn around in 2 weeks and say, no, we're not allowing that anymore. So those are just kind of a top of mind, like kind of high level,
right.
Setting up a practice, things to think about.
Right. Yeah. Ooh, great. All great thoughts. So you mentioned kind of, states, right? So what are some key areas where state laws might pose some challenges for telehealth practice you're aware of?
Well, informed consent is a big one that comes to mind. And think particularly, you have to have informed consent before you provide the services, and that's not really a new thing. But thinking about issues like minors. So you've got minors in another state, and they might be allowed to consent to their own care. They might be 17 years old, but they can consent to psychiatric or reproductive health or, drug counseling or something. So each state, those are different in every state. I've worked in a variety of states and they do vary. And then also, along those same lines, those minors can also have their records not be released. They've got rights. So there's a lot of things when you're building systems and processes, just to really be mindful of the consent issues. And I always think of minors because I've run across so many of those sorts of issues.
Sure.
Let's see. Establishing the patient-physician relationship. That's a state law issue. And that has to do with, some states might require an in-person visit before telehealth is allowed. Behavioral health is a big area for that, but in other areas as well. So again, if you're going to be doing business in 10 different states, you got to know what those laws are to make sure that you don't run afoul. Prescribing is another one. Now the controlled substances, generally, if I recall correctly, I have my notes here, you need to have the in-person first for controlled substances, but there's prescribing laws in general that vary across states too. So what can you do via telehealth? So those are some of the key state issues, other than, the general, that are everywhere, like fraud and abuse and security and privacy and, those things that we already know about, but you can't forget those. They're there.
Exactly. And, on the topic of prescribing, I would also think scope of practice might be an issue, right? Like some states might allow, like I've even seen some states allowing pharmacists to prescribe very, very very limited scenarios, certain things. A practitioner might have certain prescribing rights in one state, but not in another. And so kind of all that scope of practice type of stuff too, right?
Exactly. Yeah, all of that. And that's a great point. And that also goes back to who can provide services where, also via telehealth. I mean, HHS has a big piece in defining that, and obviously they're going to pay for that or not, but the states as well. So that's, yeah, it's complicated. It's really
it is.
complicated. I wouldn't want to set one up in a whole bunch of states. I think I'd have a headache all day long. But that's where we're headed. And I think it will get easier and more streamlined as time goes on with like these multi-state compacts and HHS rules.
Right.
I think it will streamline. I'm hoping.
Yeah. I think you're right. We're going to take a quick break, everybody, and then we're going to come back and talk some more about telehealth. So hang in there and we'll be right back.
Compliance is complex, which is why you should visit Healthicity's Resource Center. It features updates on the OIG's new General Compliance Program guidance, CEU webinars, and more. Visit healthicity.com/resources today.
Welcome back from the break, everybody. We're talking with Susan Walberg about telehealth. And I should have probably mentioned at the beginning, we're on purpose, we're kind of staying away from the billing and coding rules. We have done some other episodes with some guests that dive a little deeper into that. So we're kind of looking at this on purpose, intentionally. We're kind of staying away from those things in this particular episode. So Susan, tell us a little bit about other compliance risk areas that people might need to be aware of in telehealth practice.
Okay. I think that, I mean, you have all the same issues as with a regular practice. But I think partly because everything keeps changing, you need to be especially mindful, like you said, of the billing and coding. And I mean, I know people that do deep dives on that, and it's constantly changing, but you have to stay on top of that. The privacy and security, there's a new proposed security rule out, and that rule is going to be affecting the smaller providers because it's requiring the risk analysis that used to be a little bit more of an addressable, and now it's a mandate, along with a whole bunch of standards that go along with that. So I think that's going to impact some of these smaller organizations and telehealth practices for sure. Just keeping on top of and security, you've got people, how are they accessing? What's going on with the data? Are you storing it? What systems are you using? I think there's just a lot more analysis that needs to happen when you're dealing with data in that way. And if you're storing it, if you're transmitting it, it's just, compliance, privacy, security on steroids, and making sure that everybody understands it. Beyond the billing and the security, the other huge area, and this one I want to get into a bit, is the fraud and abuse concerns. In July of 2022, the OIG had already issued a fraud alert. And in that fraud alert, they were warning providers to be on the alert for the telemedicine, telehealth companies that were basically offering sweetheart deals to providers, getting them to sign off on orders. Things like durable medical equipment, genetic testing, the old braces, right? Everyone's always getting those fake orders for a brace or DME.
Right.
And that particular warning, let's see, I've got some of the highlights here. I have to put my glasses on, but it's worth highlighting those. The telemedicine company recruits the patient. So they come to the providers, and I'm just going through this because a provider could think that this is a great opportunity to build some business or whatever without realizing what they're getting into. The telemedicine company has the patient. So these are those phone calls that people get. If you're in a smaller practice or even in a hospital, your patient might say, how come you guys were calling me about a brace or this or that, and we never talked about that? That's these guys.
That's right.
Okay, so that's what these guys are doing. They get these patients and then they reimburse the provider based on the orders or the volume. The clinician does not have contact with the patient. Okay,
Right.
so, or if they do, it's like a 2-minute, it's very abbreviated. They have no prior history and they have no future follow-up. And then they generate this order. So the telemedicine company typically only provides certain services, right? So they don't have everything in the book. They're selling, the super duper wheelchairs or braces or whatever, and that's what it's for. So that's another red flag on these organizations. What else? I think I've covered the main points, and I have some cases here too that we can talk
Yeah.
about. But I mean, I think this is an important one because I think this and variations on this theme are going to continue to proliferate as well. The fraudsters are always, looking for new
Yeah.
ways, and as technology keeps increasing, probably more opportunities where they're going to be hacking into more records and using some of these strategies where the providers are the ones that they still need the providers. So
That's right. They need that provider to sign an order or something like that. And before we get to some of those specific cases, I'm glad you mentioned kind of the cybersecurity and the HIPAA security rule and the new proposals. Just to kind of give folks a flavor, when the HIPAA security rule was released, that was, many, many years ago, and they used the term workstation, right? Like access to a workstation. And back then it was like a computer or, a desktop or something. And so one of the proposed changes in the rule adds language to workstation, meaning it could be a phone now, right? It could be, so don't think of workstation as this physical location on a desk. Workstation, access to a workstation is almost any device now that gives you access to PHI. And so I think, that's kind of what you were referring to with this proposed rule. It would be helpful for everyone to kind of read those proposals, because it's those type of nuances that they're honing in on. They're kind of giving it an update. It's 2025 now, folks. It's not 2010.
yeah. I mean, HIPAA has been outdated, I think, for a while.
Right?
Some of the language is one of the other things, and I know we're getting a little off track, but I like to mention things when I think they're important. This whole thing about having a designated security officer, and
Yes.
that's been there. That's not a new thing. They did a little clarifying language, but I just want to point out to anybody who's listening that might be a small practice in particular that just having an IT vendor is not meeting that requirement.
That's right.
Everyone I've worked with, almost, even larger organizations, they're like, well, we have a vendor for that. It's like, is it in your contract that they're your designated security officer? Well, they do their patches. They do. No. It's a whole different thing. But people still don't understand that.
Right.
And I think that's might be why they highlighted that issue and beefed it up a little or clarified it. People need to understand that. So just, if you're not sure, check your contracts. Make sure you got someone designated, because the guy that does your patches and your software updates probably doesn't know the security rule regulations, probably isn't ready to do your risk assessment every year, or manage a breach. It's a different skill set, and
that's right. And that security officer or that security official has a definition in the regs, and it talks about things like ownership, right? That person needs to own and feel the weight of the importance of security and policies and procedures and all that. It's not just, like you said, not just that technical person who understands like an encryption level or something like that, though those are important too.
Yeah, exactly. And also, like, to add to what you said, just giving it to some guy in the IT department is not fair to that person. And I've seen that done as well. It's like, oh, well, Joe can handle it. It's like, yeah, well, does Joe really know what he's getting into?
Exactly.
I mean, he's going to be on the firing line, and
that's right.
So everybody needs to understand some of that stuff.
So Susan, I know you've prepared a couple of cases you might want to talk about as they relate to telehealth. So anything you want to share about maybe some examples of cases?
Yep, absolutely. I've got a few of them here, and they kind of go along, well, two of them, I believe, go along with that fraud announcement or the fraud alert. And these are new. I mean, these are two of them are this year. So one of them is, let's see, two Iowa healthcare practitioners have entered into civil settlements to resolve allegations they violated the False Claims Act by knowingly causing the submission of false claims to Medicare as part of a telemedicine scheme. So these guys were not only doing orders, but they were also billing office visits. They were really maximizing their opportunity there. So that was one of the ones, and they got caught for
Right.
it. And that was January 16th. So that's new.
Wow. That's new.
January 10th. Telehealth company pays $386,000 to resolve allegations of overbilling. This one was psych services, and what they were doing there was basic fudging your time records. You know, that's not unique to telehealth, but
Right. But now there's a new avenue to do it in.
there's a new avenue, and they got caught, and they're paying for it. So
Gotcha.
you know, you have people on all the time that talk about the importance of accurate documentation. So, but now it's in the telehealth realm. And then let's see, this third one I have, criminal convictions and settlements. Criminal convictions and civil settlements. Takedowns of marketers and owners of medical supply companies. Yeah, this one was just another case. This one was out of Michigan.
Okay.
And the doctors were involved in telehealth fraud schemes, ordering braces and genetic tests, you know, and the typical language here, they were accused of wasting Medicare dollars. And oh, here's an interesting, this is why I pulled this case. This enforcement action is part of Operation Happy Clickers, a joint initiative involving the U.S. Attorney's Office, the U.S. Department of Health and Human Services, Office of OIG, and the FBI. So Happy Clickers. That's the new thing.
I remember that one. And it was like you said, it was like this combined cooperation and enforcement agencies. They called it Operation Happy Clickers. They were after people, and they called it Happy Clickers because part of the fact pattern was the doctors were just clicking orders sometimes within 10 seconds. So it's like, okay, in 10 seconds, you evaluated this patient's history. Did you even see the patient? And then you said it's medically necessary. They need this DME or they need this genetic testing. And so I remember reading that one too. Part of what they were about was like, you just got these people happy clicking with their mouse, going through, 1,000 orders in an hour. And that just doesn't that doesn't make any sense. So I'm glad you brought that up.
Exactly. So those are the three cases I have. And I don't know if there was, those are just the top of mind topics that I had, but I don't know if there's any other aspects of the telehealth that you want to talk about.
No, we're kind of getting towards the end and of our time on this topic. If you have any last minute thoughts, I welcome those. But before I let you do that, I would just kind of say that what Susan has shared, I can't agree with more. It's just kind of this new avenue. Like the way to do things wrong, like doing things wrong and inappropriate is kind of always going to be around. There's always bad people. There's always people who might be good people that just get caught up in trying to generate revenue or something. So those motivations and principles are always going to be there. It's just there's now kind of new ways to do it. And people are like, oh, well, now let's get into telehealth. Everyone's doing it. Okay, but let's now apply these principles of how you can go astray in this new environment or in this new, ball field, if you will, or playground. And so, those of us that have been doing compliance for 20, 30 years kind of see these same things repeating just with a little bit different flavor or in a different space. So I'll let you, if you have any last minute thoughts or comments before we wrap up, I'll let you share those.
Just one thing. Well, I guess a couple things. One of them is AI. We've not talked about AI. That's coming hot and heavy, as we know. I mean, there's some great efficiencies to be had. It also kind of is scary because, if they start letting AI make clinical recommendations, how long before doctors are just signing off on those recommendations?
Right.
the other thing is, how are AI systems getting trained? How are they getting that data? You know, we need to be mindful of that. In fact, my next novel involves this that topic. So this is something I've been kind of digging into too, but mostly just because I'm interested in it, because I can envision a world where people are selling patient data to AI developers.
Yes,
And
because
patients aren't
they need a
consenting.
database to learn off of. AI, the whole
Exactly.
principle of AI is it needs to learn off of existing information that's out there. And
Yeah.
so, great point.
Yeah. So that's a big one. And I just suggest that people just stay on top of that. And then the other thing is, you know, like I talked about very early on, and this is just something that I learned when I did this book. There's so many agencies now that are looking at some of these issues. And I think it's very smart for us. It behooves us to understand some of these kind of new fabric of regulations. Some of the old regs are being used in new ways, you know?
That's right.
Deceptive trade practices are now being used for cybersecurity. I mean, they're really enforcing things in a weird way. You know, the jelly bean case, a web developer is now violating HIPAA, but it's treated as a false claims act. There's just some crazy stuff out there. And I think that the regulations have not caught up yet. So
That's
I
right.
just think people need to kind of understand that framework that's really kind of crazy right now, where you can have HHS or FTC, FDA, and there's, I think, a few others, SEC. I mean, they're all getting involved. You go to their websites and you can find things about telehealth and technology and cybersecurity on all of them.
That's right.
And they're
That's
being
such a
treated
good,
like false claims or HIPAA violations. I mean, it's
yeah,
really crazy.
it's such a good point. You know, your comment about AI, you know, the Department of Justice released updates to their evaluation of effective corporate compliance programs. I believe it was September of last year. And the updated language had to do with AI. They asked, how is AI being used in your organizations? And could it be leading to areas of non-compliance? So I found that interesting. And the second one on cybersecurity, you're absolutely right. I think with these False Claims Act kind of theories of how to use that law, both Penn State and Georgia Tech had government contracts. So this wasn't even in healthcare. This was in Department of Defense. They had contracts with DOD, and in the contract, it required certain level of encryption and certain level of data protection. And these universities allegedly were not meeting that. And so the government said, well, that's a false claim, right? Because you agreed in the contract, we'd pay you X, and in return, you would do all these things. One of those things was this level of encryption and cybersecurity. And so they dinged them that way. So I'm glad you brought that up. It's just kind of novel ways, kind of the same laws, but used in different novel ways.
Yeah, and I think as compliance people, and I don't want to beat this dead horse to death, but think about like when you're educating leaders and boards and you want to make them appreciate risks. I think that some of these cases are an interesting way to show them that it's a new world.
Yeah.
And there's a lot of people watching now. It's not just the OIG or CMS. There's a whole lot of folks that are real interested in cybersecurity and data protection, you know, selling data, all of that stuff.
Well, Susan, it's always a pleasure to talk to you, and I learn something every time I speak with you. I'm looking forward to reading more about this compliance thriller and making compliance cool. I love the way that you said that. And so thank you so much for your willingness to share your time and expertise.
No, I love it. You're fun to talk to. It's always enjoyable.
Well, thank you. And thank you to our listeners. As always, we invite you to submit to us topics or speakers or guests that you'd like to hear more about on the podcast. So please don't be shy. Share your ideas with us. And until next time, take care, everyone.
Thanks.